I'm Bethany Shirley. I'm one of the staff development instructors at Overton Brooks VA Medical Center. Today, I'm going to be doing a training on the components of the crash carts at our facility. First thing I want to discuss is the importance of knowing the location of the crash cart on your unit. It's so vital. And should you get pulled to another unit, make sure that one of the first things you do is determine the location of the crash cart on that unit. I do want to start by saying our crash carts are all the same throughout our facilities, and they are made to be user friendly. As you can see, they are labeled, and that allows for ease for the user so that everything can run smoothly during a code event. We'll first start by looking at the location of the defibrillators. They're all located in the same location, and they are ready for use, and we will always have on our crash carts, the defibrillator pads are always going to be connected, and you can see the connection here. This allows for immediate use and them to be placed on the patient immediately. So that's one of our features. And we're just gonna work our way down. So we'll go right here, and on these poles, you're gonna see the ambu bag that can be used during the code event. And so that's available for use. And then the next thing I want to discuss is the ACLS algorithms. Please make sure that you know that these are available, and whoever is running the code, you can take them down and you can give them to them for use during the code. Behind the algorithms, you're going to find a few other pieces of information. You're going to find a list that explains the daily check of the defibrillator and then also the weekly check of the defibrillator. Located behind that, you are going to find instructions on how to clean the crash cart after it has been used. It explains the entire process, what you need to do, and who you need to call if a crash cart has been used. Next, we're going to look at the oxygen tank. One of the things that I think is important to note is that any crash cart in the facility should actually, when you look at it, when you look at the indicator of how full the oxygen tank is, the arrow should be in the red. That's what it should be. What you need to do is you need to turn the wrench that will open and close the valve, and you need to turn it counterclockwise to open the valve. When you do that, what that's going to do is the valve is going to move up into the green. Should be in the green if it's full. The next thing you're going to do, once you open it, is you can use the flow meter to turn the oxygen tank on, and then it will be able to be ready for use for the patient. Then you're going to turn the valve, when you're through with it, you would turn the valve back off when you're done using it. And then what we have to do is bleed the extra oxygen out of the tubing, and you do that by turning the flow meter in the on direction, and you will see that the arrow will go back into the red. Once it's in the red, you can turn the flow meter off, and it is labeled on and off, and you can turn it off. And then just, if you want to do a double check, make sure that the valve to the tank is off, and it is. And again, then you will see that the arrow is in the red, and that's how you correctly check the oxygen tank, and it's how full it is. Now I want to show you, all of our crash carts have a top bin. You can do a couple of things in these bins. It's got lots of information, but one of the things that we have is we have this board. This board can be utilized as a hard surface for writing and taking notes during the code situation, but it's also made so that if you have a dry erase marker, you can actually write on this, and then you can go back and record on the record when you're done. So it just slides in, and if you don't want to use it, it just simply goes all the way back, and then you can let go of it. Inside this top bin, we have several things. You're going to find an extra set of defibrillator pads for use. You're going to find some electrodes if you need to use the monitor function. And then also, one of the other important things that you may find is you're going to find the CPR record form. That's there for you. And inside, we also have some gloves, a mask with a shield, and then a shave prep tray. Remember that our carts are going to be locked. and the cart that is going to be located on the floors are going to have a lock. You will have to pull that and unlock it so that you can use it. And then we're going to look first at the medication drawer. On a cart that's out on the unit, you're going to see there is going to be a label, and it's going to have an expiration date, and that date's going to be for the drug that's going to expire next. So that's something you always want to be checking. And then in this drawer is going to be all of your medications that you would use for a code blue event. Easy to access, easy to get. Moving down, just as labeled, you're going to see your needles, syringes, and your IV start kit. This is where all of your sharps and items like that are going to be located. You'll find your IV start kit, your syringe, your IV catheters, your blunt tip needles, some scissors, and then you will also find alcohol wipes as needed, just like it says. This drawer is a little wider, has a little more in it. You're going to have your Salem sump in it, which is your NG tube, your blood pressure cuff, and then your Easy IO kit in the event that you need to insert an intraosseous needle. It's all there. You're going to also, so your Easy IO kit will be here. You're going to find catheter tip syringes and an irrigation kit. You will find blood pressure cuff and also a pressure bag if you need it. The next drawer is going to be your IV solution drawer. And in this drawer, you'll have your IV solutions and any tubing that you would need, primary tubing, secondary tubing that you would need for patient use. The bottom drawer is just as labeled respiratory supplies and suction setup. And in that drawer, you're going to find an extra ambu bag, things that you would need in case of intubation, including things to secure an ET tube, suction catheters, all of your tubing for oxygen. You have a face mask if you should need it, lots of extra respiratory supplies. You do have in this drawer, you have suction equipment. This would be used if you need to place it into the actual wall. So you have a suction setup, and then you have an actual wall suction regulator that you can use if you need to use it. So with that being said, talking about suction, we do have the availability to use the regulator for the wall suction, but on all of our crash carts, we have the portable suction. So one of the important things about the portable suction is knowing how to turn it on, and then knowing how to increase or decrease the suction pressure. So there is a green button which turns it on, and then on the side of the portable suction there is a plus sign. If you want to increase the pressure, you just simply dial it. It just turns. Dial it towards the plus to increase the pressure, dial it down to decrease the pressure. And if it's working properly, and you'll turn it on. And of course you would hear it, the loud noise that goes when you turn a suction machine on. While I'm here, I do want to point out on the back of our cart is the backboard. You would take it off, you simply remove it, it comes off, and you would put it underneath a patient if they are lying on a soft surface, and then that way the surface can be hard when you're giving chest compressions. On the side of our cart, on this side, on the right side, you're going to find supplies that you would need for intubation. We have two bins. They simply open, and in the top bin you have things for the glide scope and the LMA, and that they would utilize. And in the second bin there is where you're going to find the stylet and different sizes of ET tubes. So this is a really important side in the event of intubation. That's where you're going to find your supplies. And then on the bottom we have a sharps container. That way, easy access when you're doing a code, you can simply place your sharps into the sharps container located on the cart. So this is the crash carts at our facility. Simple to use, user friendly. If you should have any questions or any concerns about the crash carts at our facility, please feel free to reach out to the educators at Overton Brooks.